femoral artery, arteria femoralis, in popliteal fossa, continues into popliteal artery. And border between femoral and popliteal, that is what? Hiatus adductorius, that is canalis adductorius. This is arteria genus descendens from femoral artery, and then here it is popliteal artery in inferior angle of popliteal fossa subdivides into two terminal branches. They are posterior tibial artery and anterior tibial artery. Anterior artery passes through opening in membrana interossea cruris. Branches of popliteal artery. It gives two arteries for knee joint superiorly, that is arteria genus superior, medialis and lateralis, arteria genus inferior, medialis and lateralis. All of them goes to the network of the knee joint, arteria articularis genus, the same like arteria genus descendens, and arteria genus media. This artery not participate in network. It passes through capsule, goes inside of knee joint and supplies intra-articular structures. For example, ligamentum cruciatum genus, anterior and posterior, ligamentum transversum genus. They are intra-articular structures of the knee joint. Now, arteria tibialis anterior, before opening in interosseal membrane, gives arteria recurrens tibialis posterior, and after this opening it gives arteria recurrens tibialis anterior. And now we can speak about network. This network forms with the help of 7 arteries. 2 superior arteries of the knee joint, medial and lateral, 2 inferior arteries, medial and lateral. 1 artery is arteria genus descendens, and 2 recurrent tibial posterior and anterior arteries. That is network, rete articularis genus. Now, posterior tibial artery. Posterior tibial artery goes into the canal. Remember which canal? On posterior side of the leg, between musculus tibialis posterior and musculus soleus. That is cruropopliteal canal, canalis cruropopliteus, and this artery posterior tibial goes to this canal, cruropopliteal canal, and from in this canal posterior tibial artery gives arteria peronea, or another name is arteria fibularis. This artery goes to another canal, that is canalis muscula peroneus inferior, between fibula and musculus flexor hallucis longus. This artery gives anastomosis with posterior tibial artery and with anterior tibial artery. Arteria perforantes with anterior tibial and arteria communicans with posterior tibial. Supplies lateral muscles of the leg and gives 2 terminal branches. They are ramus malleolaris lateralis for network of the lateral ankle, and ramus calcaneus, which goes to the rete calcanei. They are terminal branches of arteria peronea. Now, posterior tibial artery, it surrounds malleolus medialis, medial ankle. It gives branch for medial ankle, that is ramus malleolaris medialis for network. And after that, it subdivides into 2 arteries. Arteria plantaris lateralis, it is main, largest artery of the foot, and arteria plantaris medialis, medial plantar artery. Lateral plantar artery It passes in sulcus plantaris lateralis, goes to fifth metatarsal bone. Here it goes medially, and makes anastomosis. From dorsal surface we have arteria plantaris profunda, deep plantar artery from dorsal surface. And together deep plantar artery and arteria plantaris lateralis makes plantar arch, arcus plantaris. From this arch start arteria metatarsa plantaris, plantar metatarsal arteries. This plantar metatarsal gives arteria perforantes, which goes to dorsal metatarsal. After that, they continues into common plantar digital arteries, arteria digitalis plantaris communis, and common plantar digital subdivides into proper plantar digital arteries. Sometimes we have anastomosis between middle plantar and lateral plantar arteries. If this anastomosis is present, we speak about superficial plantar arch. But sometimes this anastomosis is absent, but anastomosis between lateral plantar and deep plantar arteries, it's always present. Now, anterior tibial artery, arteria tibialis anterior. I already said about two recurrent arteries, and it gives two branches for malleolus, both ankles, middle and lateral. For middle ankle, it gives arteria malleolaris anterior medialis, and for lateral ankle, it gives arteria malleolaris anterior lateralis. After that, it goes to dorsal surface of the foot, and here it has name arteria dorsalis pedis, dorsal artery of the foot, and it gives arteria tarsa medialis, arteria tarsa lateralis, then it gives arteria arcuata, and arteria arcuata anastomosis with lateral tarsal artery. From arteria arcuata we have arteria metatarsa dorsalis. First metatarsal dorsal artery start from arteria dorsalis pedis, that is first metatarsal, and from dorsal artery start arteria plantaris profunda, which goes to plantar surface and participate in plantar arch. One again, branches of dorsal artery of the foot, arteria dorsalis pedis, arteria tarsa medialis, arteria tarsa lateralis, arteria arcuata, anastomosis with arteria tarsa lateralis, first metatarsal dorsal artery, and arteria plantaris profunda. From arteria arcuata we have dorsal metatarsal arteries, and dorsal metatarsal receive anastomosis with plantar metatarsal through arteria perforantes and subdivides into dorsal digital arteries, arteria digitalis dorsalis. And last moment, in the region of ankles, middle and lateral, we have networks. Arteria malleolaris medialis forms with the help of ramus malleolaris medialis from posterior tibial artery and arteria malleolaris anterior medialis from anterior tibial artery. And network in the region of lateral ankle. Ramus malleolaris lateralis from arteria peronea and arteria malleolaris anterior lateralis from arteria tibialis anterior. Both networks, retromalleolaris medialis and lateralis, supplies ankle joint, articulatio thalia cruralis. That is all.